Countries are on alert for it. The World Health Organization is tracking it, and now Singapore has detected its first case of the Delta plus COVID-19 variant. Well, here's what we know so far. According to the Health Ministry, the case was imported and there's no evidence of it spreading to the community. In terms of transmissibility and severity of illness, Delta Plus is expected to be similar to other Delta subvariants. And for now, it's listed by WHO as a variant of interest, not a variant of concern. Well, let's find out more about Delta Plus from infectious diseases physician Dr. Leong Hoe Nam from the Rophi Clinic. Welcome back to the show, Doc. So can you explain, first of all, why Delta Plus is expected to be similar to other Delta subvariants in transmissibility and severity of illness?
Delta Plus is not really very new. We had it for the last few months. In the first half of this year, it was already there. And of course, it came out when Delta was actually ravaging the whole world. Now, Delta Plus has a slight edge over the Delta strain which we have. It is a bit more transmissible, and the early studies suggest it's about 10% more transmissible. And that's because there are mutations in the spike protein that allows it to enter the cells a little bit better. But in terms of the resistance to treatment, resistance to vaccines, the severity of illness is pretty much the same. So if you actually put it all on a level playing field now with the Delta and the Delta Plus, eventually the Delta Plus will take over because it's more transmissible. But the pace at which it happens will not be like the switch from the Alpha to Delta. It will be at a slower pace. And for that reason, we can thus see why WHO is calling a variant of interest. They are interested in it, but they are not very worried about it at the moment.
Right. So building on what you just said, what conditions does a variant have to have in order for WHO to, I guess, reclassify it from a variant of interest to a variant of concern?
We need to have a certain number of people that are infected with it, and ideally over a few countries and many different areas. We also like to see that it is a lot more transmissible than just the ordinary strains which we have been having or experienced. We like to see resistance to the existing treatment, the resistance to the existing vaccines, or the immunity which the previously infected individuals have. When you have this, a sudden shift, a sudden change, then it becomes a variant of concern. If there's not much change in transmissibility, there's no change in resistance to treatment or resistance to vaccines, then it becomes any other ordinary strain, and WHO wouldn't bother with it, and it wouldn't even be called a variant of interest or concern. So in other words, whatever that's going to change status quo in the world will make it a variant of concern.